Hi there everybody, Nate Eaton, and today I am in Phoenix about to get a whole body MRI from Prenuvo. This is something that I heard about recently, and I've really over the past year or so been trying to live healthier, eat less, exercise more. I have a history in my family. My dad had a heart attack when he was in his 50s. The BRCA breast cancer gene runs on my mom's side of the family. Breast cancer is prevalent there. Fortunately, a few years ago, I got tested for that and I was negative on the gene. But I'm right now in just about 20 minutes going to go get this whole body scan, and here's what they say that it can find. Solid tumors as early as stage 1. They'll scan the whole spine and look for degenerative spine and joint conditions, metabolic disorders like a fatty liver, neurological disorders such as multiple sclerosis and dementia, at least possibilities that those things could be developing, along with non-cancerous conditions such as cysts, hematomas, aneurysms, and brain health assessments.
We are actually ready to take you back, so I'm gonna have you follow me right this way. Good. Okay. And then have you had any scans before?
I have not.
Oh, this is gonna be exciting then. I'm gonna bring you right
I'm a little nervous, I'll admit. But...
It's okay, we got you.
Yeah.
And then I'm gonna go right around this corner to your dressing room.
Okay, so everyone comes and gets a little dressing room.
Yes, and this is everyone's own personal dressing room, so it will lock behind you while you're in the scan and all of your personal items are secure.
Okay.
But we have some scrubs set on the chair for you.
Okay, I think I'm ready.
Hi, are you Nathaniel?
I am, how are you?
I'm great, how are you?
Good.
Good, my name is Tina, I'll be doing your MRI today.
Okay.
I just have a few safety questions to go over.
Great.
I know you filled this out already, but we just want to double check. Do you have any implants or devices in your body?
No.
So nothing mechanical, no pacemaker, stimulators, aneurysm clips, coils, nothing like that?
No.
Perfect. Any injuries to your eyes involving metal?
No.
Any injuries involving BB, shrapnel, or bullets?
Nope.
Do you have any medication patches, glucose monitors, hearing aids, cochlear implants that you might have in?
Nope.
Any procedures done to your body within the last 8 weeks?
Nope.
Perfect. And any history of seizures?
Nope.
All right, you ready?
I'm ready.
So whenever you're ready, you're going to be on your back. Head is going to be in here, shoulders touching up here. I'm just going to be placing these sandbags on the sides of your legs. This is just to keep your legs sealed during the exam. Nathaniel, how's the volume for your show with those scanning noises? Do you need me to raise it or lower it?
No, it's fine, thank you.
Yeah, absolutely. Yeah, delivered, yeah. All right, take your time standing. You might be a little busy after all of that. Feeling okay?
Yeah. That went by pretty quick, especially because I was able to watch a show during the whole MRI. Well, my results are back. It's only been 3 days. I'm really excited to go over them. I actually have a meeting this morning with the doctor from Prenuvo who's going to go over them with me.
I'm Dr. Vikash Modi. I'm the Senior Medical Director for Preventative Medicine, so a primary care trained doctor. Everything came back looking really healthy. Globally, we do an assessment of your entire image set, and then our radiologists sort of give a rating. We've established at Prenuvo, and this is sort of like a globally recognized scale system now, at Prenuvo we use OncoRads. Instead of BI-RADS just for breast, we use OncoRads for the entire whole body. You scored a 2 out of 5 on OncoRads.
Okay.
All right, so that's again a very low risk of any active cancer based off of our imaging. So let's talk about the brain itself first. The brain is very healthy appearing here. We have no evidence of any aneurysms. You don't have any evidence of any masses or tumors growing inside the brain at that 3 millimeter threshold mark. And we'd also see healthy brain volume. So you sort of see how these, involutions of the brain white matter come in there. Sometimes when people start to get older with high blood pressure, with diabetes, the brain starts to deteriorate, and we'll start to see that on these scans.
Would that show maybe like signs of dementia?
Exactly right. Now, what we're seeing circle on the scan here is your sinuses. You were pretty congested at the time of the scan. So what you'll see in my notes is really basic recommendations here. If this is sort of like a temporary thing, then basically some nasal saline once or twice a week, maybe some nasal sprays that you get over the counter like Azelastine or Flonase, which are not dangerous for you. Now, the next little window of your body that we looked at here was the lungs. In this picture, it's this top cavity here. Your lungs look great. No masses, nothing inflammation inside the lung cavity. So what we point out here on this picture is your liver. That's this organ here. And what we found in your liver is just a very, very tiny little cyst measured 2 millimeters. Now, you remember before I said, hey, we're going to see things around 5 millimeters. We got lucky and caught one at 2 millimeters here. And that happens. Like if it comes right on the slice thickness, right on the slice that we cap, we'll get 2 millimeter, 1 millimeter little spots. So we got lucky with yours and caught a 2 millimeter cyst. Lucky is debatable. We don't do anything with 2 millimeters. This isn't nothing. We don't want you to chase this with ultrasounds and CT scans. Don't do any biopsies. Don't let anyone stick a needle in you. The only thing I'd recommend here is just keep up with your annual blood work to make sure your liver is functioning well, which I'm guessing you're doing anyway. This is the left kidney. So now in the left kidney, we did detect a tiny little cyst in the kidney. So sort of similar to the liver cyst, very small. I think the measurements on this one are like 3 to 4 millimeters. The location of it is called pelvic calceal. So that means just like in the pelvis of the kidney, which is what we call this inner lining, the pelvis. This is where all the functions of the kidney really live. This is where you're filtering out things from your body. You develop just a little bit of a cyst right there. These are also considered low risk. This is not something that we recommend going to follow up with a nephrologist, getting an ultrasound, getting a CT scan. Based off the size and location, it looks really innocent. So this is your neck cross-sectional picture. This is the back over here. This is the front of your neck and your thyroid glands right down here. And so what we're saying on the cervical spine is that you have really mild degenerative disc. So right down here at C6 and 7, a little bit of a bulging disc is pushing up against the spinal canal, which is that white space. It's not touching the spinal cord, which is that black space.
Okay.
This is incredibly common, Nate. Like this is like 95% of patients I talk to are going to have this.
Oh, okay.
So this is nothing special, nothing unusual. It still, to me, warrants the conversation, which is like, if you have neck pain, neck stiffness, let's work on it. That was actually the last set of pictures I've got. You know why?
Okay.
Because the rest of your scan was really boring.
Good. I'll take boring.
Your hips and knees showed no degeneration or inflammation. Your sacroiliac joint, which is kind of your tailbone into your hips area, and your shoulders didn't show us any remarkable signs of inflammation, wear, or tear.
Well, it looks like I couldn't ask for any better results. Those were perfect for me, and I'm glad to have this knowledge as I'm getting a little bit older and hopefully taking care of my body a little bit better. The Prenuvo MRI ranges in price between around $2,000 to $3,000, around $2,500. There is a discount code you can use. We'll put a link in our story that gives you $300 off if you use that code. They are in big cities across the country. There's one in Vegas, Los Angeles, Atlanta, Denver, Phoenix. The one that I went to was in Phoenix. Some other cities, you can go check out their locations. I'd be interested if you do go, how your experience is, to hear about it. The folks took really good care of me, and as technology advances and these things become more and more common, hopefully we can have a little bit more knowledge about our health and then do stuff about it. So that is my journey with getting a whole body MRI. My thanks to the folks at Prenuvo who took good care of me and who really helped me kind of have a peace of mind for the next few years. I'm Nate Eaton. Thanks for watching.